Dr. John Torres here, Dr. John with NBC News on his Facebook Live, covering some headlines and some news, giving you an update on Halloween safety precautions since tomorrow is Halloween. Want to make sure that you have fun, but you do it safely, and then answering questions you might have. So if you have questions, please send them our way. I'll try to get to as many of those as I can. But first, let's start with headlines. And the biggest one right now are the numbers that are happening across the country with coronavirus cases. And right now, yesterday, we set a record for over 90,000 cases here in the U.S. The previous record was Wednesday. That was over 80,000 cases, and now we're 90,000. If you think back to June, July timeframe, we were getting worried when we had 75,000 cases. We were hoping at that time that we would drop down to a baseline of around 10,000 cases, and then we could have a breather. We could get ready for the upcoming winter months, which we knew in the winter months that coronavirus would be worse, the pandemic would be worse, because that's the way this virus works. It spreads more in cold weather for a couple reasons. One, the virus itself is more active in colder weather. That's the way these viruses work. Flu viruses, coronaviruses, rhinoviruses, which also cause colds. Number two, we're moving indoors, which means we're not going to social distance as much. And we do know that being outdoors, especially that outdoor air, can help dilute out the virus and make it less likely you are to catch it from somebody else. And then number three, if you think about it, during the winter months, we do a lot of coughing, sneezing, we have runny noses. Well, that's the way the virus can spread as well. And so that combination, we knew once we got the cold months, we start seeing more cases. Here's the issue. We haven't yet really gotten to our cold months. We're still the end of October, beginning of November time frame, and we're seeing these record numbers happening. So that has a lot of experts worried that we're going to start seeing even worse numbers happen over the next month or two. And as a matter of fact, one expert I talked to a couple weeks ago, I thought put it well. He said that we are in for 6 to 12 weeks of what he called the darkest period of the pandemic. That 6 to 12 weeks is going to be between Thanksgiving and New Year's. And that time period, we end up going to see family and friends. That moving across the country, moving throughout the country, and getting together with others that we're normally not with during the pandemic can fuel the spread as well. So you have to be very, very careful with that. And I'll go over some holiday tips, particularly for Halloween, in just a little bit. But looking at numbers again, 90,000 cases yesterday. That is a record that we never wanted to reach, but we have reached at this point. We also, over a 7-day period, had 540,000 cases over that 7-week period, or 7-day period. That was from last Friday to this Thursday. That's the most we've had since July. And that again is showing us that this pandemic is getting fueled even higher and higher with these case numbers occurring not just on 1-day period, but over this last week or so. And we expect it to get even worse. Now, here's the other concerning thing. Is when you think of the pandemic and you think of these cases, think of things happening in 2-week increments. And so we're seeing cases right now, and typically what happens is you get infected, and then 2 weeks later you start showing up as cases. You start showing up as actually COVID, meaning you have the symptoms behind it, and start going into the hospitals because you're starting to have problems from the symptoms. And then 2 weeks after that, that's when the deaths start occurring. So what happens today is going to fuel this increase in hospitalizations 2 weeks from now, and then 2 weeks after that, fuel this increase in deaths. And so everything is a bit 2 weeks delayed. The reason I'm bringing that up is because sometimes people say, you know, this last week I've done everything I can. The numbers are not dropping. Well, the numbers are not going to drop initially. They're going to drop over a 2-week increment. And then 2 weeks after that, hospitalizations hopefully won't go up. And then deaths won't go up hopefully after that as well. And so again, remember, the things you're doing today are going to show the responses and the results 2 weeks from now. And so getting that under control, wearing masks, social distancing, washing hands, opening windows when you can, those 4 W's, mask, to wear the mask, watch your distance, wash your hands, and windows, opening windows, is going to be the thing we can do to keep this under control. And then once we get the vaccine, we can add that to the 4 things, not use it in place of the 4 things. If you're also looking across the country, 1,000 deaths a day are happening across the country, almost 1,000 deaths a day. And a lot of cases, a lot of states are saying they're seeing over 1,000 new cases a day as well. And so over 30 states are seeing that. But this is not something that's just isolated to us. If you look around the world, other countries are having issues as well. The UK, for example, is saying in Manchester that some of their hospitals are running into problems, and they're having ICU issues. They're reaching capacity, having to get people to other hospitals or open up outside facilities, surge tents and things like that. Belgium and Romania are having issues as well. They're seeing record numbers. And if you look across the spectrum, they're seeing a lot of these record numbers happening in the northern hemisphere states. Now, the reason, again, it's happening in Northern Hemisphere countries, is because of this cold weather again, and it moving around because of the things I talked about. If you look at Southern Hemisphere type countries, you can look at Australia. Their numbers are extremely low. New Zealand, they've been low for a while, but they really clamped down on everything and shut their country down, essentially, their borders for a while. And so that's why they're doing so well with coronavirus. There are some countries in the Southern Hemisphere, Argentina being one of them, that are having issues, but they're having issues a lot of times because of people either going into the country or because they're not able to control it very well initially. But if you're looking at most overall Southern Hemisphere countries where the weather's starting to warm up, the cases are starting to get better as well. Doesn't mean it's a warm weather virus, but our human behavior in warm weather facilitates getting numbers under control. Our human behavior in cold weather facilitates getting those numbers higher and higher, which is where we're at right now. So again, the important thing to remember is we're coming into a time period where there's a lot of concern over surging cases, and this happening more and more often, cases going higher and higher. 90,000, we don't want to go higher than that, but I think we are going to over the next few days before it starts coming down again, assuming that we do those things we need to do to keep us and everybody else safe around us. So that's the numbers and where we stand right now. The other thing I want to talk about is holiday safety. I mentioned earlier that the one expert was saying 6 to 12 weeks of the darkest period of the pandemic is going to happen between Thanksgiving and New Year's, because that's the time period we end up traveling a lot, which means we can take the virus from one part of the country to the other, or from another part of the country back to where we live, and we end up being with families and friends that we haven't been with for the past 8 or 9 months, and that can fuel the spread as well. So there are some things you can do for the holidays, and actually Baylor Medicine came out with a holiday checklist. And I talked about this a little while ago, but let me show you the holiday checklist again. It's from Baylor Medicine, and it's a pretty good checklist. And a couple of things I want to highlight. Number one, it says start right now. So even though Thanksgiving is still 3+ weeks away, you want to start right now to get prepared. That means getting your flu shot, making sure you have masks, you have hand sanitizer, making sure that your travel plans are set now, even though it seems early. And the same thing for the December holidays. Look now to what you're going to do there. And that means looking at things like, am I coming from a hot spot or am I going to a hot spot? What are the quarantine requirements where I'm going to or where I'm coming from? How are my family and friends as far as their health? Are there any elderly people or those with pre-existing medical conditions we need to be careful of? And then what kind of group gathering are we going to have? Is it going to be indoors? Is it going to be outdoors? More than likely indoors, because it'll be cold weather. If it is indoors, is it going to be a large enough place that we can all social distance if we need to? And here's the key. If you go with your family, then keeping with your family group, you can do that. But if you're with other families, even if they're close relatives of yours, then you need to social distance from them during these events, because, again, they're not people that live in your own household. Also, you want to keep the group small, regardless of how much space you have. 10 seems to be the ideal number or below, but look at your state guidelines as well, because some states are saying, like here in Colorado, in Denver, for instance, they've lowered the number, even for private gatherings, down to 5. The rest of Colorado, they say 10's a good number, but you don't want any more than 2 families together. So even if the 2 families only each have, a couple of, a husband and a wife, or a couple together, then you don't want to get too many of those couples interacting together in the same environment. And so looking at that for the holidays is going to be extremely important. And one thing they put on here, which I think is going to be interesting to see how it works, is actually making somebody what they call the Family Bubble Commissioner. And the Family Bubble Commissioner is the one who's essentially going to go through the checklist and make sure everybody's following the checklist. And for me, the beauty of this is it gives you that excuse that you don't always want to use, telling your friends, your family, hey, we really need to do this. That way it's not just your idea, but it's the idea that's basically backed by science. Again, Baylor Medicine is showing that this is the checklist they think will help us make sure that as we get closer to the holidays, as we travel through the holidays, and as we are inside the holiday day itself, that we all do things safely so we're not spreading the coronavirus to ourselves, our loved ones, our families, our communities, or across the country. You can find it. You can go to NBCnews.com and just Google family bubble or holiday bubble, and you'll see it there, the checklist. Easy to find, and it's easy one to follow. But now the biggest holiday coming up as close as can be is Halloween, which is tomorrow. So there are some things you can do for Halloween to be safe. And this morning on the Today Show, the big question they asked is they actually wanted to myth bust a little bit. And one of the biggest Google searches out there are people are saying, is Halloween canceled? Absolutely not. Halloween is not canceled, but this is going to be a different Halloween than most Halloweens. So you want to be careful. You want to be extra safe. To help out, the CDC has actually put out some pretty good guidelines. And in those guidelines, they actually divided it into 3 different categories: low, moderate, and high-risk activities. High-risk activities they want you to avoid. And that means doing things like we probably did in the past. Going door-to-door trick-or-treating, the children, especially doing that because you're interacting with somebody else. You aren't necessarily social distancing. And that's kind of the whole theme here. The less you interact, the more you social distance, the less your risk is of getting coronavirus. So door-to-door trick-or-treating, indoor parties, any of those types of things where you can't social distance, you're interacting with other people who aren't out of your own household, those are high-risk activities you want to avoid. Now, as far as low-risk activities, think of things you do at home. And basically what they're talking about are things like scavenger hunt with your own family, pumpkin carving with your own family, maybe doing virtual costume contests with other friends you have around the world through the computer, and that way you're not interacting with each other. Those are things you can do that are low-risk activity. But we all know that one of the things for Thanksgiving is to go out and do that trick-or-treating, have other people see your costume, get that candy, which is, of course, the prize that everybody wants. So when you do these type of trick-or-treatings, they put that in the moderate category, but it's not door-to-door trick-or-treating. It's what they call one-way trick-or-treating. And what they want you to do there is essentially put out a table or something and then have the candy out there in prepackaged packages. And that way they can come by and pick it up. And the example I can give you, if you remember years in the past, we've all done this. There's a bowl of candy. You hand out candy to different children or people that come by, or people go in and they get it themselves. The problem is there's so many hands in there that aren't in your own household that you can pass coronavirus that way. So instead of having the bowl full of candy there, just do them in pre-packed packages here, where you can put candy inside, put them out on a table, and then people can come by and pick one of these up. One of the big questions I always get is, okay, they do that. Do we have to be worried about the candy? Do we have to clean the candy? No. One thing you might want to think about is wiping the outside of this, washing your hands, and then opening this up, getting the candy out, and making sure, again, your hands are clean before you open the candy and go ahead and eat it. But you don't need to clean every individual package of candy. Again, remember, this is more of a respiratory virus, so it spreads that way. But again, make sure that kids are out there wearing masks. Make sure that you take hand sanitizer with you because it's going to be important when you go door to door, or not door to door, but house to house, that people sanitize their hands. And just take care of your safety as best you can with you and your children. And remember, remind your children, do not go up to the door, do not ring the doorbell, do not do those types of things because you want them to be as safe as possible, but still at the same time have fun. Another moderate risk activity they talk about is a costume parade where everybody social distance and wears masks. Just think of imaginative things you can do that can let you still have fun, but do it in a very, very safe manner. That's the key here. So again, going over the headlines, numbers have really skyrocketed over the past few days. Yesterday, a record 90,000 cases. Over this last week, 540,000 cases over a 7-day period. That 90,000 is a record. That 540,000 is the most we've had since June timeframe. So again, making sure that we do those things we need to do to keep us safe because we're going into our cold season and our holiday season, which could be even worse. We don't want to get to that point. And then holiday safety, particularly Halloween safety, just be very imaginative, but keep social distancing in mind. Keep wearing masks, and remember to wash your hands. Do most things outdoors if you can. Those are the keys to having fun, enjoying it, but still staying safe, both you, your family, and your kids. So now let me see if you have any questions.
Should we wear a mask under our Halloween mask?
That's a great question. Should we wear a mask under our Halloween mask? Now, here's the guidelines the CDC puts out. Their concern is if you're wearing a mask and you have your Halloween mask over your cloth mask, it can be difficult breathing. So what they're saying is try and incorporate your mask into your costume. That way you don't have to wear both, and they recommend not wearing both, one on top of the other. And especially for children under the age of 2, those with breathing problems, they need to be extra careful with masks. And it's probably best that they stay home and don't go out because, again, we don't recommend children under 2 or those with breathing issues to wear masks. But for everybody else, use this mask instead of the costume mask because this can certainly help make sure you stay safe, and use it constantly when you're outside because you never know when you're going to come across somebody who might, run across, inside that 6-foot distance, or the kids run up and they do something. They go up to greet people because that's the old-fashioned thing we've done. So you just want to make sure that they stay safe as well.
Aren't the number numbers higher because of more testing?
So I talked about those numbers. 90,000 people we're seeing a day, which is what we saw yesterday. 80,000 a day before yesterday. And the question is, aren't the numbers high because of testing? No. Because if you look at it, there's 1,000 deaths a day. We're talking about hospital systems around the country that are starting to be inundated with hospitalizations. And we haven't even reached that peak yet, I don't think. And so these numbers, even though testing probably does add a little bit to those numbers, that's not what's going on here. Positivity rate is going up, meaning the number of people that are actually positive throughout all the testing. Hospitalizations are going up. Deaths are probably going to be following that as well. And so that shows us that not only are these numbers being fueled by increased testing, which to a small amount they are, but they're also being increased by real numbers that people are actually getting sick. And again, we're just moving into those cold months. So you want to be very, very careful with that. But, thank you for your questions. Fantastic as always. But again, remember, headline number one, the number of cases we see here, 90,000 plus yesterday. My guess is we're probably going to see either around that or maybe more than that for today as well. So just kind of keep an eye on that. The thing we can do to keep it down and to get those numbers lower are the human behavior things behind controlling the pandemic. The 4 W's, as I call them. Wear a mask, watch your distance, wash your hands and windows. Ventilate whenever you can, especially if you have people over who aren't in your family during the holidays. Think about ventilating, opening windows, even if you have to turn the heater on. If that works, try and do that. If you can go outdoors, even better so. And then Halloween safety. Tomorrow, have a great time with Halloween. Have a lot of fun, but be very imaginative in your safety measures because that's going to be utmost important. So this year at least, the going up to the doorbell, ringing the doorbell, the trick-or-treat the kids typically do, shouldn't be done this year. Instead, that one-way trick-or-treating we were talking about where you lay out the candy on tables in these prepackaged packages, and also doing things more at home, more virtually if you can. That's going to be the thing that's going to keep us safe. But the important part is to have fun through the holidays, enjoy family and friends as best you can, but do it with safety in mind because the last thing you want to do is go to somebody's house and find out later that either you or them had COVID and spread it to others, and that there could be implications and complications from that. So you want to be very careful, but at the same time, have fun, enjoy the holidays, and in particular, this weekend, have a happy Halloween.